All right, it looks like it is recording and there will be a transcript. Oh, fantastic. It's doing it as I speak. Okay, let me go ahead and start and open this workshop by reading an introductory statement. Small business impact statements are available on the division's website, or you may obtain a copy by contacting Tammy Carney via email or phone or mail at the Bureau of Healthcare Quality and Compliance, Division of Public and Behavioral Health, 4220 South Maryland Parkway, Building A, Suite 100, Las Vegas, Nevada 89119. Tammy Carney is an administrative assistant 4, and her phone number is 702-486-6515. And Tammy's email is tcarney, so that's TCARNEY at health.nv.gov. So that's HEALTH.nv.gov. And this is kind of kooky, but if you're not already connected or here in the room, to telephonically participate in this meeting, you can dial 775-321-6111, and the conference ID is 944.525.619, and then pound. Again, that's a necessary statement that we must read prior to any public workshops to allow people to connect telephonically. And again, the number is 775-321-6111, and the conference ID is 944.525.619, and then the pound sign. Okay. The purpose of this workshop is to provide an opportunity for the public to assist the agency in continued development of these draft regulations. The draft regulations will then be subject to a public hearing conducted by the Nevada State Board of Health. Testimony and written material submitted during this workshop will be considered during the final development phase of these regulations. In the event your recommendations are not included in the proposed draft of the regulations, you may also present testimony and materials for consideration to the Nevada State Board of Health prior to or during the public meeting. If you intend to submit written materials to the Board of Health, they should be addressed as follows. Cody Finney, Secretary, State Board of Health, Division of Public and Behavioral Health, 4150 Technology Way, Carson City, Nevada, 89706. Sorry, I have to read all of these canned statements. Materials submitted 15 days prior to a meeting of the Board of Health, for which this item will appear on the agenda, will be included in the packets sent to the board members for their review. We anticipate these regulations will be presented to the March 2024 Board of Health meeting. Before providing us with your comments, please state your full name and facility affiliation, if any. If you have a copy of any written comments, please provide us with the same. This workshop is now open to receive your comments regarding the agency draft of regulations to modify Legislative Council Bureau File R016-20, Cultural Competency Training. So with that, I'd certainly appreciate hearing any comments. I've got a couple of people here in the room. I know that several individuals sent written testimony, and if you'd like to read that testimony in now, that's fine. But let me first go around the room. Do we have any comments from you guys, or are you here to kind of hear what happens? Okay. Any comments? No? Okay. Okay, so please feel free to raise your hand or just go ahead and begin speaking, and I will put my microphone on mute.
Paul, I suggest we start with those who are on Teams so they can raise their hand, since we have a lot of people here. So if those on Teams would raise your hand, and like I said, let's try to keep it, give people plenty of time to speak. So start by raising your hand, And I'll go ahead and call out names based on the order hands are raised. And so that way we can kind of keep it a little organized. How's that sound, Paul?
Thank you very much, Nathan. That's much more organized than I would do it.
All right. So the first hand I see is Leo Molina. Leo, if you'd like to go first.
I'm muting.
We can hear you.
Okay. Good morning. Good morning, everybody. My name is Leo Molino. I'm the AHON president. And thank you very much for giving us the opportunity to hear our testimony. First of all, I would like to read the testimony I sent to Paul Schubert regarding the small business impact statement dated 10/25/2023, sent by Ms. Cody Pinney, the administrator of Nevada Division of Public and Behavioral Health. The AHON Executive Board would like to submit or this input to the cultural competency training in accordance with AB 267. Letter A, based on the calculation regarding approximate current cost of cultural competency training provided in item 3 of the small business impact statement versus the approximate cost upon full implementation of the proposed amendments, there should be a marked decrease in cost to small businesses. And letter B, hence the agency is limited in its ability to further reduce the cost of this training on small businesses. However, with the proposed improvement associated with submission, review, and approval rejection of courses, there is a potential for increased reduction in costs for those facilities that generate and submit facility-specific courses. In reference to letter A statement, we would like to suggest a trainer strategy. A residential facility administrator, RFA, will take a cultural competency training from an approved third party of CCT, and once the RFA is certified on CCT, she will be allowed by the DPH to train their staff. If this input will be passed or approved, the economic impact to small businesses is much lesser. Secondly, in reference to letter B, the statement, very few small businesses providers can submit facility-specific courses due to complicated requirements. Vista Adult Care already experienced this in the last 2 years. We have a hard time in getting the approval. We would like to recommend, in accordance with April 4, 2023 bulletin, that cultural competency training for the staff of small businesses do not require training to be repeated. This statement should be properly stated in the proposed amendments. Then, again, if this input will be passed or approved, the economic impact to all small businesses is much lesser. In addition to that, like us, we have 5 employees. Annually, we spend 1,575 annually. And for the 100 employees, like AHON, if I computed that, we spend 31,500 annually just for this training. And for me, I conclude, it's only the third party is making money on this training. Also, if the RFA is not allowed to do the training, annually, since RFA is the one responsible for everything in the operation of the facility. We would like to recommend that this training should not be repeated. Again, thank you very much for your time.
Thank you, Mr. Molino, sorry.
Yes,
Appreciate it.
thank you.
And I'll ask folks who are coming next, for the sake of time and efficiency, as much as you can, kind of like in the legislature, say ditto, or be brief in your agreement. That would be great. All right, next on my list of hands raised, I see Tara McMullen. Tara McMullen, if you want to unmute and give your comment.
Okay, hello, this is Connie McMullen. That Tara is my daughter, and so be it.
Oh,
Anyway,
okay, sorry.
I appreciate the last speaker's comments. Well said. On behalf of the Personal Care Association of Nevada, the following is public comment on proposed amendment changes of NIAC 449 regarding NRS 449.103. With the passage of Assembly Bill 267, the law seeks to reduce the burden on healthcare facilities by generating regulations with minimal standards. PCAN supports the proposed amendments that reduce the number of hours and frequency in which cultural competency training is required, which will reduce financial burden on both small and large businesses licensed in the state. Cultural competency training is a valuable tool for personal care attendants, like elder abuse and dementia training already mandated in regulation. Additional training in cultural competency offers valuable insight to provide better care. PCAN supports reducing the frequency of cultural competency training to biannually, the number of hours of cultural competency training to be applied towards the annual 8 hours of personal care attendant training, and that training be completed in a 45-minute to a 1-hour course. Additionally, PCAN supports cultural competency instruction within the first 6 months of employment. PCAN and other providers in the personal care industry would like to be involved in the public workshop process of cultural competency training before future decisions are made or added requirements are introduced before the Nevada State Legislature. We thank you for your dedication regarding this valuable and important work on behalf of caregivers and those they care for, and we appreciate consideration of our public comment today. Thank you very much, and thank you for your time.
Thank you, Connie. And I believe we received your written comments. I just wanted to go back and thank you very much. Mr. Molino, if you had not already sent those, please send a copy of those comments to us so that we will have a transcript of them.
Thank you very much, everybody. The next hand raised I see is from a Jesse Wadhams. Jesse Wadhams, if you want to go ahead and unmute and go ahead.
Yeah, good morning. This is Jesse Wadhams. I'm representing the Nevada Hospital Association. Did send some comments to you, Mr. Schubert, yesterday afternoon, so I won't repeat all of those, but we do appreciate the opportunity to provide some feedback on the regulations. And we are continuing to get feedback from our members, and so we look forward to additional workshops, I hope, before the March 2024 State Board of Health meeting to adopt this, because I think there are a number of components to as we operationalize this regulation going forward and make sure it follows the intent of AB 267. So without repeating the written comments I was sent in, we do kind of focus on a couple of areas. One of them is section 10. We think that section, as written in the regulation, appears to mean that there's a handout of paper rather than the posting that NRS would mandate. So we want to make sure that syncs back up with statutory intent. And then we proposed a number of amendments particular to section 16, and that's the approval process. And we would like to see some streamlining of the process in that area, particularly with courses that meet the approval. Those should be deemed approved. Courses that maybe have minor deficiencies, those should be addressed very quickly and expeditiously. And then those that have more major deficiencies, work through those with at least a process that gets to an end result in a more speedy manner. Again, I think the other thing we're looking to do is build out as courses are approved, as materials are deemed approved in various courses, that those can be added to a library going forward so that those are now pre-approved sources, pre-approved courses. Again, look forward to working with you and your team, Mr. Schubert, and hopefully having a couple more workshops as we continue to get feedback. So always happy to answer questions and look forward to chatting with you.
Thank you, Mr. Wadhams. And I did receive some questions from the industry, the hospital industry yesterday, very similar to what you were discussing, and so maybe they were the same, and gave some responses this morning. I don't know that we will necessarily have additional public workshops like this unless we're making substantial changes to the draft regulations, which we may, based on some of the comments today, and then have additional workshops. Otherwise, if we're making some minor changes and then those go to LCB for their drafting of the proposed actual regulations that will go to the Board of Health, then we may decide not to have additional workshops. But certainly if we're making substantial changes, we would do that.
Appreciate it.
Thank you.
All right. Next on Teams, I have someone just under the name of Bryant, B-R-Y-A-N-T. Bryant, if you're listening and want to make your comment, please unmute and go ahead.
Yes, thank you. My name is Bryant Jasky-Moser with Infinity Hospice Care. We operate both in Reno and in Las Vegas. For the sake of time, I just want to say that ditto in regards to much of what has been said in regards to the impact financially on small businesses and the approval process as well. We too would like to see an expedited process in order to get these approved. We currently spend quite a large sum of money on a train the trainer program that is now obsolete with the recent revisions, and we're being forced to add additional resources into revising our current training program in order to accommodate the changes. And we completely agree with the changes that are needed, but the process of utilizing resources such as the ones provided by NHPCO have been denied because it, quote, didn't utilize enough resources to support the training.
Thank you, Brian. Appreciate that. Next I see on the list is Jimmy Lau. Jimmy Lau, if you want to unmute yourself and give your comment.
Good morning. For the record, my name is Jimmy Lau, and I'm the Vice President of Ferrari Reader Public Affairs, representing Dignity Health St. Rose Dominican. First, we would like to thank the division and the Bureau for their willingness to answer our questions on the initial draft and work with us to clarify certain provisions in the regulations. We look forward to the opportunity to continue this work over the coming months ahead of the Board of Health's adoption. Regarding the draft regulations, we first would like to echo the comments of the Nevada Hospital Association and would like to request the following additional revisions be considered. First, to ensure that currently approved programs may be effectively operationalized upon the effective date of the bill, add a new section in the regulations to specify that any program currently approved by the division under LCB file number RO16-20 automatically remains approved upon the effective date of the proposed regulations, and that such automatic approval remains in place for a period of not less than 3 years. Second, to ensure that administration of currently approved programs will be in compliance with the regulations when they go into effect, we would ask that Section 13, subsection 1 be modified to require an agent or employee to receive annual cultural competency training through a program which has been approved by the division, and require that such training be provided through any approved program, including those programs currently approved under existing regulations. However, the number of hours required for the program approval must not exceed 2 hours per year. Third, to ensure less onerous implementation by facilities, modify Section 13, subsection 2 to clarify that a facility's maintenance of records of employee and agent completion of the training program are deemed to be within their personnel file if the facility maintains such records in a learning management or other similar system, and that the facility can produce such records to the division upon request. Fourth, and finally, to ensure a clear path to program approval, modify Section 16, subsection 4, to specify that when the department does not approve a proposed program after the program is resubmitted following an initial denial, according to Section 16, subsection 3, that the department must identify any deficiencies that remain in the program along with its notification of denial. Once again, I'd like to thank the division, and we look forward to continuing to work on these regulations as they move forward. Thank you.
Thank you, Mr. Lau, and I believe it was you who I responded to this morning, but you may have not been able to yet read those responses. In the meantime, I appreciate the additional information you're providing that of areas that you would like changed in the regulations.
All right, next I see Alan Ward has his hand raised. Alan, if you want to unmute and give your comment, go ahead.
Thank you. Alan Ward with Homestead. Also provided the an approved third party at CareWorks. I just want to identify very quickly a couple of things. First and foremost, that many of the people or the providers that are required to do this are working in a non-medical environment. The other part of that is I want to make sure that when we talk about this training and we approve this training, it's commensurate with the education level or the comprehension level of the attendee or the person learning it. Many times there are concepts and things that were required in this training that were over the head of many of the average provider's employee, including myself. Then I just want to reiterate once again, a position from PCAN and from myself is, you know, a 30-day window from the time of hire is unreasonable. We believe a 6-month window for the initial training. We believe that training can be 45 minutes to an hour, and that the frequency should be biannual or biennium in nature. And last, that this training should be applied to our 8-hour regulated or our required 8-hour training each year for our caregivers. Thank you.
Thank you, Alan. Next, I see Joan Hall. Joan, if you want to unmute and give your comment, please. Thank you.
Good morning. Thank you. Joan Hall, representing Nevada Rural Hospital Partners. Just want to echo what Mr. Wadhams and Mr. Lau have already stated. And some of our concerns are very similar to theirs with regard to approval of these courses. Specifically, I think we have some concern with Section 15 about the instructor, making sure, you know, this says 3 letters of recommendation for the instructor, that they have experience in providing cultural competency training. I think that's difficult for smaller rural areas to find that. We have our instructors that we already use who are doing these courses. We certainly don't want that disrupted. And we hope that the timelines will be quicker in this new process than they were in the last. And, you know, we've had many comments about that. So look forward to continuing these conversations. Thank you.
Joan, I'm just curious, do you have some recommendation for language regarding the instructor qualifications or how we've structured that in the regulations? And you don't need to come up with something right now if
okay.
if you
yes,
can.
we can help you with that. Yes.
Okay.
Yes, thank you.
I
Thanks,
appreciate
Paul.
it.
Okay, that's all I see on Teams at the moment, which is fine because we have a lot of people on the phone. So let's try to move on to those folks. Thank you to my colleague who helped me out. If you want to raise your hand and you're on the phone, press *9, and that should raise your hand on the phone, again, I'll just say we greatly appreciate if you agree simply with what others have said. A ditto or I agree is always welcome, as well as any brevity you can muster to allow plenty of time for others to speak. So again, I'm showing *9 if you're on the phone to raise your hand to make any comment. Go ahead and raise hands. I'm not seeing any phone hands raised. So if it's not working, if you'd just like to unmute and give us your name, full name, would be great to go along with your comments. If it is working and nobody has any comments, I'll give it another couple of seconds here to see what happens.
You gotta raise your hand. Yeah, raise your hand.
Oh, I see a hand raised from Scott Reddy. Scott, do you want to make a comment?
Yeah, as soon as I figure out how to unmute. Oh, are we, am I live?
If you can get a little closer to your microphone, please. It's a little hard to understand. You're kind of muffled.
Okay, that should work better. So yeah,
Oh,
my wife got her administrator's license in California and this year, and she says that the cultural competency in elder abuse training in California, you only have to take it once.
So would the recommendation be to modify our regulation so that it would only be taken once?
I don't know. I think I heard other people say every 2 years, which seems reasonable. Currently, we have to do it 8 hours, which is excessive. I think it's good stuff, but 8 hours is just way too much time. But I would say maybe every 2 years. But I just want to say that California only does it once. Not that we should do everything California does.
All right. Thank you, Mr. Reddy.
Thank you.
And again, I'll open it up. If you're on the phone, *9. Or if you're on Teams and didn't go before, again, feel free to raise your hand and make comments. Oh, I'm seeing a 909 number ending in 2299. Raise your hand. Would you like to unmute and speak? Phone number ending in 22. Oh, press *6 to unmute. Sorry.
There we go.
Hi, my name is Jody Brooks, and I am with FlexEd, and we are a current third-party provider. And my comment is that I am in agreement that the training is long and it is quite a burden. However, with the current regulations and guidelines as they exist, taking that training from what ours is right now is an 8-hour self-study module down to what they're saying, 45 minutes to an hour, would require that the regulations change quite a bit as far as what needs to be included in the module.
Great, thank you.
And I'm sorry, Josie, I think that was your name. I'm just trying to discern a recommendation from what you're saying. Are you still there?
Again,
Perhaps.
Josie, if you want to have me, oh, go ahead. Sorry.
The recommendation is that that the list of items that need to be included in the training would need to be modified to reduce the number of hours down to a 45-minute to an hour training. So
okay. Now I understand, and I appreciate that. Unfortunately, within the regulations, we can't modify that list because the list is provided through statutory requirement. So, but I understand what you're saying. If we were to, in order to reduce the time, it would be difficult to continue to provide information on all of the subjects provided in the statutory requirement.
Correct.
Okay, thank you.
All right, again, if anybody else has comments, please use star 9 if you're on the phone. And then if you're on Teams, just use and again, if you're on the phone, either unmute using your mute function or star 6. We'll give it a few minutes to see if anybody else has comments. Oh, I'm showing a Spencer Flanders. Spencer, would you like to unmute and make comment?
Yes, good morning, everyone. My name is Spencer Flanders. I'm with Tri Strategies representing Freedom Care. I'm going to keep my comments real short. So we just want to make sure that we're staying in the statute with NRS 449.103, making sure that family members are exempt from this training. And we just want to make sure that's continued via the statute. Thank you.
Thanks, Spencer. Anybody else? I don't have any hands raised at the moment. Again, use Teams to raise your hand or star 9 if you're on the phone. I'm showing a Steve Messenger. Steve, go ahead. Unmute and go ahead.
Hi, good morning. My name is Steve Messenger. I'm with the Nevada Primary Care Association, and we are a third-party provider under the name of Nevada Cultural Competency. I just want to kind of echo the comments of the other third-party provider, Josie, that spoke up. It's going to be very difficult to stay in line with all the requirements of Section 15, which again points back to NRS 449, all the categories of paragraph A to F inclusive, and getting evidence-based peer review sources, all in this very shortened time period. And so what I would recommend is that you put some allowance in there for this to be taken in bite-sized pieces. I think that rather than trying to have a 45-minute or an hour or even a 2-hour sort of race through overview every period, depending on who's taken this course, that you kind of make some provision for, in this period, you can study one of these sections. You can study race and ethnicity. In the next period, when you have to retake the course, you can study sexual identity and sexual orientation and gender identity. I'm not positive that the law allows for that, but I think if it doesn't, then the envisioning of these time periods being so short and following, covering all the groups that are required to be covered at the depth that's specified is pretty impossible at the way that it's written now.
Thank you for those comments, Steve. I know that there's some language that we allowed for things to be done in a modular fashion, but maybe we can massage that a bit to see if, again, not looking at expanding the time frame, but maybe that's what maybe that's the recommendation to expand that time frame, but allow it over or to be presented over a longer period of time in modular settings.
Just to add on to that, the way we envision, the best use of our course, we've got an 8-hour course. If that could be broken into 4 2-hour modules, I think that would be ideal, given that we feel confident that that's the breadth of the information that needs to be conveyed. And then, people could decide, okay, what module do I need the most education on in this given period? That's how we would like to ideally see it. I'm not sure that we're going to get that, but that makes the most sense to us from a provider perspective. Thank you.
Thank you.
I see a couple of Teams folks jumping in again, but I do see one phone number that I don't believe has spoken yet, so I'm going to skip to that number, ending in 9305. Again, either unmute using your function or *6 if you want to go ahead. Phone number 9305, looks like you're unmuted. Do you want to speak or make comment, I mean?
Hello, can you hear me?
There you are.
Yes. Yeah, my name is Jose Castillo here in Reno. Good morning, everybody. I'm also a part of a group homeowner. I was just wondering if they can just do this like online, like the way that you guys do it in elder abuse. Is that a possibility? Because that will save us a lot of time, especially that we're having a hard time with our caregivers right now. We have a shortages, and not only that, it's too expensive for us to bring them out and take this training. I was just wondering if they can just keep it like an online training.
Since it's a simple question, I'll go ahead and answer it. Yes, the regulations would allow for the training to be presented online, either participating actively or I don't know how to describe it, but going through the course at your own pace.
Yeah, my point though is that can we not do the same thing like elder abuse process, or that we can just do it every year the same way?
Well, the elder abuse training that the division, and I believe it's actually the Division for Aging Services, has online and is approved, it is a course that they generated and that we approved and that facilities can use to train their personnel regarding elder abuse in accordance with the statutory requirement. We don't have that sort of a course established yet for cultural competency, but certainly it's a consideration for future.
Okay, thank you very much.
Okay, we can go to those who are speaking again. I'm sorry, I forgot what you said your first name was, but McMullen, you'd like to make another
yes,
comment?
Thank you. For the record, Connie McMullen. I just want to support the concept of streamlining the training, but I want to also make a point in that there are two divisions of from what I see in this legislation, of employees here. And the personal care attendant, I represent the Personal Care Association, is an unlicensed employee. They do not require the higher level of education that, say, a lot of the employees that work for the hospital does. And so I think that should be considered in consideration of their required level of training and their high school education, because we are facing, as was previously said, a caregiver shortage. Recruitment and retention of caregivers has become very difficult. And at the end of the day, we want to make sure that people who need the care get it. And to make it more difficult for that to happen is, it's painful to our residents. And so I just wanted to make that point. We're talking about two different groups of populations here of employees with different levels of skill set. So thank you.
Much appreciated, Connie. If you've got some language that you would recommend, and again, you don't need to do that here necessarily, but if you could send it to me, that would establish perhaps the level of the training or the level of education that should be provided. Maybe we can find a way to incorporate that within the regulations.
Thank you. I will. Thank you.
Thank you.
And again, I'm showing Scott ready with hand raised. Scott, if you'd like to speak again.
Yes, I want to pretty much echo what Jose Castillo said about having the training, like we get elder abuse training from ADSD online, and then we take a test afterwards. And I'm wondering I'm thinking about the history of the elder abuse training. How did that start? Was it the same way this type of training started, and then eventually people came up with training for it?
I was attempting to just answer a simple question. That one's a little more complicated. And, this obviously isn't the forum for question and answer. But if you've got some recommendations for changes to the language or how we can accommodate the industry better through the language, please provide them.
Yeah, well, how about what train? I know talking to some of the surveyors came through, they had a 2-hour training they took, and then we had to take an 8-hour training.
So would your recommendation be for 2 hours of training?
Yeah, I think 2 hours should be more than adequate. Less than 2 hours is probably desirable. It's pretty much, it all boils down to the golden rule: do unto others as you would have them do unto you, and just you have to treat everybody the same.
All right, thank you.
At the moment, I'm not showing any more hands raised. So I'll say one more time, if you're on Teams, go ahead and use the raise hand function, or if you're on the phone, press star, I think I get it mixed up, star 9 to raise your hand and get your place to make a comment. Alan again, go ahead.
Thank you, Nathan. I just wanted to bring, as a point of reference, during the initial hearings, when they passed and then statute and it turned into 449.103, the legislators had asked Brooke Maylath at that time as an expert witness, or her statement was during those hearings, how long would it take? Cultural competency training could take 30 to 90 minutes, depending on the age of the individual. And that was really part of the hearing when it initially passed statute. What is it, 4 years ago now? Thank you.
Thanks, Alan. Not seeing anyone else. We'll do a 60-second count. Nope, never mind. Bob Reading.
Hi, my name is Bob Redding with Comfort Keepers Home Care here in Reno. And I echo and ditto the prior comments that I think 8 hours is way too much, 2 hours every other year we could support. But my question is more from a procedural one. We have a lot of employees that work for us as well as 2 or 3 other agencies. Who is the employer of record and who is responsible for paying for the training and maintaining the certificates when we get audited? Thank you.
And again, I think it's Bob. This isn't necessarily a forum for question and answer, but do you have a recommendation based on those comments for inclusion of language in the regulations?
I don't know, but the question would be who's the owner of the training certificate? Is it the employer who paid for the training or the employee who took it? Because when someone comes to us now from another agency, they can easily prove they've got TB tests and physical exams and the educational requirements. But if they can't possess that ticket, it could be possible that one employee is going through cultural competency 2, 3, 4, 5 times a year as they go to different employers, because we are unfortunately a fairly transient workforce.
Understood. I'm not sure how we would regulate that. Again, you're asking about the ownership of the certificate. I believe the individual receiving the certificate should at least have a copy of it. I don't know how else to look at that.
Well, we could put them on the honor system. They could say, yeah, I went through the training, and that'd be good enough, right? LOL.
I'm showing a few more hands raised. I'll start at the top with the Clint Moxery. Clint, you'd like to unmute and make comment?
Oh, this is Clint Moxley, the owner of Seniors Helping Seniors in Reno. And I would like to, again, echo Alan and Robert's comments. 8 hours is way too much for cultural competency, in my opinion. 2 hours every other year. And again, the problem of ownership of the certificate is a huge one. Again, if the employer is paying for it and then the employee moves to another agency and works with another agency, they have to go through the training again with the new employer. I don't know how you get around that, but an online course that would, similar to elder abuse, 2 hours, take the course online, get your certificate. It's a free course to the employee, just like the elder abuse is free. And then they can come to the employer with that certificate and say, here's my proof of cultural competency training. I took it online at home on my own time.
All right, thank you, Clint. I have someone on the phone, area code 909, last 42299. If you'd like to unmute and give comment.
Hi, this is Jody Brooks again. I just wanted to ditto that I believe that the certificate should be took by the person that belongs to the person that took the education and moved from place to place. That would make it a lot easier for the employers.
All right, thank you. And then next, I have a Tyler Mirlis.
Hi, this is Tyler Morellis from Tahoe Forest Health System. We're a health system that kind of toes the line between Nevada and California. So we really are hoping that you guys can, and this is an echo and ditto of really defining that language with the instructors having experience with cultural competency before training it. And then any courses that are submitted, we want to echo that comment of being critical of any defects in those modules that are rejected so that we can correct and resubmit in a timely manner. Thank you.
Thank you, Tyler. At the moment, I'm not showing any more hands raised. So again, if you're on Teams, pardon me, and have a comment, please use the raise hand function. If you're on the phone, *9. And I just saw a hand raised from Tina Holland. Tina, if you want to unmute and go ahead.
Thank you. Good morning. I just wanted to make sure that the group knew that at least in the personal care agency business, our turnover is 70% and higher. So my experience is that I often will hire somebody, rush to get them trained with cultural competency, and under 90 days, they're moving on outside of this industry as they look for a higher paying job, whether it be as a barista or in a retail position. So my experience is that the caregiver's commitment to this industry is short-lived, and it has created a huge financial burden for my agency as I pay for each person quickly to stay compliant with state regulations. And before I even get the certificate in the mail, that employee has moved on. So I wanted to share that experience, and perhaps there are others that are having the same. Thank you for putting this together.
Thank you.
Thank you, Tina. Not showing any more hands raised at the moment. So again, Teams, press raise hand. On the phone, press *9. Clint again, go ahead.
I just like to, again, agree with Tina 100%. The transient nature of this business and the amount of caregivers that we run through that come in and try this job and then say, you know what, this isn't for me, or I found a higher paying job, or I need something more permanent. I need full-time work. The problem of getting them trained and getting them compliant and then getting the certificate and having them move on. And I just threw the money in the garbage because now they're no longer even being a caregiver. It's a huge financial burden on the agencies.
Good. Thank you, Clint. Anybody else? Anybody else? Chris Hyatt. Chris, if you want to unmute and make comment.
Hi, this is Chris. I work in a small clinical office, medical office. We are not accredited to be able to do Medicare or Medi-Cal. Not that changes anything, but that's where some of the training all stems from and how things go to be. That being said, with regards to what Tina said, I would echo that sentiment. In this business, it used to be that people would come on board and they would stick around for a while. But now with the fast moving aspect of somebody not staying put in a job, we barely get them trained, get a certificate, pay for that course, and they're moving on down the road. Not to mention we've paid them for 8 hours to sit and watch these videos. That's a large sum of time to take up. And the redundancy of the content that is currently on the program itself is a lot. It's just, I feel like I'm going through like, I don't know, it's like a Twilight Zone going through the same exact content and statements made over and over and over again. And then to think that we should do it annually every time seems also very redundant. When you put that kind of redundancy in front of somebody, eventually it falls on deaf ears and nobody's listening anymore. And if you really want people to actually pay attention and to hear the content, you have to give it to them. I believe in, infection control and all those things should be a redundancy because you have to. But, most everybody in the healthcare field, have you been in it for any time at all, this having an 8-hour course every year just does not make any sense with the turnover that many of us are experiencing today in this culture in healthcare.
Thank you, Chris. And just to be clear, your recommendation would be to reduce the time? Would you want to reduce it beyond the 2 hours that are established right now in the draft regulations, or is that?
I still think 2 hours is a lot. Many of us get this on multiple levels in general anyway. I think making it a 45-minute, refresher course annually would be reasonable, just to make sure. But when you're asking at the high rate of turnover that many of us are experiencing, I mean, it's horrible right now. The redundancy for the staff becomes that if they start another job, that's the first thing they're going to do, and they've barely been gone from one office and they're doing it again. So it loses its capacity for people to really sink their teeth into and actually acknowledge as something that they should be learning and paying attention to.
All right, thank you. We got folks going again. So we'll go with Leo Molino first.
Hi, this is Leo Molino, the AHON president again. I just want to make a clarification, Paul. First, the one that our testimony, I sent you the email already. Yesterday. Please check your email. And then, secondly, I think we have to make a clarification on the bulletin, which is dated April 23, 2023. It is stated there that the CCT will not be repeated. But some surveyors, we experience this here in the North, they are requiring us annually. So we have to clarify those system that regarding about cultural competency. Is the bulletin still effective, or are we going to follow the new one?
Obviously, once we adopt new regulations, we'll be following those regulations. That bulletin was put in place as a stopgap measure with regards to the bill language for AB 267, I believe, until such time as we could generate these regulations. So the bulletin is still in place and still effective, but depending on the language in the regulations, we'll determine whether or not there's a periodicity to the training.
Yeah, I think we have to educate our surveyors regarding that system, because some of them, they are implementing the rules which is not stated. So it's confusing.
Understood, and it's a confusing time. I mean, the reality is we have a LCB file that's in place that establishes some regulations which require a certain amount of training. And then we have that bulletin, which is a stopgap measure between the new legislation and these regulations. So you're right. We need to see if we can clarify that some more. I appreciate it.
All right. Thank you very much.
I will clarify. There is language at the top of the web page that we built for this, dpbh.nv.gov/cultural competency. And I put that link in the chat as well for those who are on the phone or on Teams and can click it. But I am trying to also keep that information at the very, very top of the page, starting through you guys.
And thank you, Nathan. That's a good point. That we've tried to mitigate confusion with that web page, and hopefully we're doing that. But in the meantime, I think Mr. Molino is also speaking about making sure that our enforcement is consistent among surveyors. So I appreciate that.
All right, thank you very much.
Tina Holland, would you like to make comment again?
Yes, thank you. We're talking about the impact to agencies. I'd like to share the impact of this training on clients. During my last inspection this year, I needed to have all of my caregivers up to date on cultural competency immediately. So we quickly organized one day, 18 caregivers for cultural competency. That left all of their clients without care during those hours. I don't have enough volume of caregivers standing by to fill in shifts. We don't have backup caregivers when we have to take people out of the field. So those clients are left without personal care, which is what we're supposed to be providing. The next day, maybe I had an additional 20 or between 14 to 20 who I immediately needed to get certified. So those clients were left without care. So we have people in the community needing care, but we're taking their caregivers out of their homes to train them. And then honestly, within under 90 days, they move on. So it's a real, push-pull. It's a strategic logistical nightmare to cover these people who are paying us for care. And now we have to take their caregiver out of their home to get them trained. And they'll be moving on shortly. So I just wanted to share what's happening in the homes of these people. This is the impact it's having on our clients. We are supposed to be committed caring for.
Thank you, Tina.
Thank you. Next, I'm showing Karen Redding. Karen?
Yes, hello. I would like to go back to the elder abuse issue. The fact that something as important as elder abuse can be a test and can be completed in 1 hour for free online, and cultural competency cannot, seems crazy to me. It would, by putting cultural competency in that same specter where you're able to do it like elder abuse, would get rid of the ownership of the certificate problem, the cost, taking people out of the homes for 8 hours. It would only be done in 1 hour. They could do it at home before they come in and when they're first getting hired, like we do. I'm with Nevada Senior Services. Everybody has to do elder abuse before they start working, so they don't miss any hours of working. I think that something as important as elder abuse, if it can be done in 1 hour for free, certainly cultural competency can as well. Thank you.
Thank you. I will, just for everyone's knowledge and for following the process, at the top of that dpbh.nv.gov/cultural competency page, I will also add a link to the regulation process page, so you can, follow the different steps and processes in addition to receiving whatever emails we send out. I'll add a link there so that everyone can click that and follow the process along. I'm not seeing any more hands raised at the moment. Again, Teams, click the raise your hand function. On the phone, press *9.
In the interim, I'll just say that we really appreciate everyone participating today, because it's a village that actually puts together these regulations. We can't do them in a vacuum where we just come up with them and give them to the industry. We want to hear from the industry. We want to hear from program developers. We want to make sure that we're trying to comply with the statutory requirements in developing the regulations. And so we really appreciate everyone participating today and providing comments. And this really truly is your opportunity to give us recommendations that will work for not only for the industry but for the patients, clients, and residents out there that are being cared for. We want to hear what you think and then use that to generate these regulations in a form that will be beneficial to everyone.
I'm not seeing any more hands raised at the moment, so one more time. Teams, click raise hand, or phone, press *9. And thank you to everyone for being so polite and organized and raising your hand so we can keep this moving. Since there are a lot of people participating in the public workshop today, we appreciate that.
And we'll just give a couple of more minutes to allow anyone who hasn't been able to either get their electronics working or something like that, but then we'll consider closing the meeting.
Bryant, one more time.
Yes, earlier you had mentioned an email where we could forward any additional suggested language. What email is that for those of us who maybe are in the process of taking notes, gathering our thoughts in order to help draft such language?
Absolutely. And I'm going to give you two because the one that is on the official transcript is Tammy Carney, and she's an administrative assistant within our bureau. And that email for her is tcarney@health.nv.gov. So tcarney@health.nv.gov. The other one I would give you is my own, and many of you have already communicated with me and sent your recommendations to me. And mine is, of course, P as in Paul, Schubert, Schubert. So P Schubert at health.nv.gov.
I also put both.
Again, there's no C in Schubert, just Schubert.
And again, I put both email addresses in the chat. If anybody needs them and is on Teams, it can get them that way.
Oh, thank you, Nathan. All right. Is there anyone else wishing to be heard concerning the revisions to regulations for R016-20? Of course, those are the current regulations. We're revising those essentially with all new language. Hearing and seeing none, this workshop is now closed. Thank you very much.
Thank you, and I will be stopping the recording.